Hi everyone, welcome to my channel. My name is Amanda and this is a vlog of my late autism and ADHD diagnosis. Today I'm going to talk about occupational therapy and how it can be really beneficial to people who are autistic, ADHD, OCD, generalized anxiety disorder. It also can be beneficial to many other people, but those are the areas that I can talk to. And I'm not going to spend much time talking about ABA, or at least try not to, but I have to mention it because most of the time when a parent finds out their child is autistic, the first advice they might get is that you need to sign your child up for ABA therapy. That was the original treatment for autism. I've made some videos in the past and I've talked negatively about ABA, and if anything, over the last, year and a half, my stance is just getting more and more strong that I wish that ABA would just disappear, go away. My personal opinion, that ABA is torture. There's no way around that. There are exceptions to when you need to go to ABA, and there are very extreme exceptions. One is if your insurance will not pay for occupational therapy or any other therapies and you need support with your child, because honestly, it takes a village, right? And you need outside support sometimes for any child, not just an autistic child. And if ABA is the only support that you can afford because of insurance, you take what you can get sometimes. In that case, try your hardest to find an actual individual human therapist within the system that is autistic affirming and not trying to make your autistic child mask. That's basically, ABA is dog training for humans. It is telling an autistic person how to behave and appear like a neurotypical person. And in the short time, it looks like, oh, my child is happy and healthy and integrating into society. But what it's really doing is telling your child that everything that feels natural and correct about them is wrong, and it causes stress hormones to build up in their brains and trauma, and at some point they're going to hit burnout because masking our natural who we are causes trauma, which leads to burnout. The other option when, again, you might need to use ABA is if you have an autistic child who is harming themselves. And again, that is the support that you can find and get to, harming themselves or like you or other people, and you need immediate help. Again, this is something occupational therapy can also address. I'm just saying that if ABA is the only support you can get in that time, then use what you can get. But my general stance is ABA just needs to go away. I know that there are some ABA therapists who are trying to kind of rebrand and say, hey, we're going to be more autistic affirming. I personally feel we need to focus on occupational therapy or maybe new other therapies. I know there's some other ones that I don't know enough to speak on, but they're out there, and just abolish ABA. The founder of ABA was also the founder of, hold on, Watson, gay conversion therapy. And I feel like that's really all that needs to be said about that. Okay, so for occupational therapy, I started occupational therapy with my kids before we actually got our autism diagnosis. My kids hit burnout at around 13 and a half. All of a sudden, everything in their life was harder and they were struggling. And I'm trying to figure out how to summarize this. Basically, when they were 7 is when I started noticing differences about my children. I have twins, and my kids actually started talk therapy at 7. And at 7, I asked their therapist, hey, do you think my kids might be autistic? And she said no. And she said no with such definitive conviction that I didn't follow up. Which I should have, because at that point I didn't realize how uneducated many counselors, doctors, therapists are. And I took her authority and just rolled with it instead of continuing to advocate, other than keeping them in therapy, which was helpful, but it wasn't enough. But by the time they hit 13, they were starting to learn to mask so much, and then they could not keep up their masks, and they hit burnout, which my daughter got temporarily diagnosed with depression because that's what it looked like. And I'm like, what's going on? And they were suddenly too anxious to do things that they normally could do before that because of the burnout. And so the pediatrician was able to diagnose them with generalized anxiety disorder while we were waiting on our autism diagnosis. Because at this point, I had now done more and more research, and I'm like, my kids are autistic and possibly ADHD. And they did. They got diagnosed autistic, ADHD, and my son also has OCD. So while we were waiting, because we were lucky and we were able to get an autism diagnosis within like a month, because we went to a place that specialized in teens and adults, so the wait list wasn't as long. Some places 6 months, a year, sometimes 2 years. But if you can get a generalized anxiety disorder diagnosis, then oftentimes that will, like, the insurance will let you start occupational therapy with that. So whatever you can do to get the help. And when we went in to talk to the occupational therapist, I told them we suspect autism. And so we were really able to tailor our therapies based on that, because, I mean, anxiety is part of autism, not inherently, but because of society, there's so many situations that cause anxiety for autistic people that they're like, the comorbidity is like pretty much, I would say, almost at 100%. You probably have some autistic people who don't have anxiety, but it's going to be a really low number just because of the society we live in. So I was trying to get to this part faster. Well, that's fun. I've been talking for like probably 15 minutes without recording because my dog distracted me and I didn't push the record button back. So I'm gonna back it up and try to repeat everything that I've just said that didn't get recorded. I'm not very good at second takes, but we're gonna do my best. Okay, so the part that I wanted to get to a little faster in this video, but I had to bring all the context and all the background information, was how occupational therapy has actually benefited my family. And while I said I wasn't going to talk too much about ABA, one of the things I want to point out is that occupational therapy is always child-led. It is autistic affirming and child-led. So if my kids do not want to work on something, then we find something else that they are wanting to work on. A perfect example of this is when I first started occupational therapy with my kids. They both had separate, appointments and everything. Even though they're twins, they're very much individuals, right? And Ira, my son, had a bunch of things that he specifically wanted to work on. But at that point, my daughter Izzy was like, nope, I don't want to change. I don't want to do anything. And so we respected that. We did not actually, after she tried occupational therapy for like 1 or 2 sessions, she was like, there's nothing here that I want to work on. So we stopped occupational therapy with her. And then it was quite a while longer, maybe even a year, maybe not that long. I don't know. I'm time blind. ADHD time blindness. She was coming up against some issues in school, which I'm going to talk about. And she's like, wait, I think occupational therapy might benefit me from this. And so we got her back in, and now she's been going for a couple of months, and it's helped tremendously. But it has to be child-led. See, ABA is like, it talks to parents like, what do you want us to change the behavior of your child? And then they use like coercion and rewards and punishments in a very negative way to make the child change their behavior. But it's in such a way that's going to cause long-term trauma. You get short-term results, but long-term negative results. So some of the things that occupational therapy has helped with my family specifically is, one, both my kids suffer from ARFID, which is avoidant restrictive food intake disorder. It's really common for people with autism because of the sensory issues surrounding eating. So I'm going to talk more about my son because he struggles with it a little bit more than my daughter even. And in occupational therapy, OT for short, we talk about tips and tricks and things that we can work on to see if they will make a difference. Like a lot of times it's trial and error because you just don't know. And what works for one kid is not going to work for another kid. So for instance, this last week, we were talking about how the smell of food can be so overwhelming for my son. So we're going to try that because I have a 2-story house and he's usually upstairs, and then I call everyone down for dinner. And when he comes downstairs, that wall of the smell of the food is just so intense that it takes him 15-20 minutes before he can kind of like normalize the scent in order to eat the food. So we're going to try to have him come down while I'm cooking. Maybe he can chat with me a little bit. And that way he gets used to the smell as it's cooking, and it won't be so intense when it's time to sit down to eat the food. Another thing is, before we even had the autism diagnosis, he was starting to choke and get like having trouble swallowing his food. And I took him into the pediatrician because this was really concerning for a teenager to suddenly, or preteen at that time, suddenly like start choking on their food. And he had to get x-rays, and he had to do something called a swallow test. They were looking to see if he had some kind of growth in his throat. Everything was coming back like fine, normal. Unfortunately, again, doctors don't have enough information about autism, and my pediatrician did not realize that if a child starts gagging on foods, especially since we narrowed it down as a family that it was certain textures of foods that he was gagging on. That should have been a big red flag to the pediatrician that, oh, this might be a food sensory issue, which is very common in autistic kids. But anyway, once we got the autism diagnosis, we're like, that's why he was having trouble swallowing these foods, because the textures of certain foods were making him physically gag. And he was masking because he knew that I put a lot of work into cooking dinner, and he was trying to make himself eat the food because he didn't want to hurt my feelings, because he's a freaking sweet kid. And I had no idea that he was like literally trying to force himself to eat food that his brain was telling him was dangerous. So now we've backed that up. We're working on, making textures okay for him, not forcing him to eat foods that are going to make him gag, and working with the foods that his brain says are okay. And in occupational therapy, we talk about how we need to rotate our safe foods, because if you stick to a small number of safe foods and then all of a sudden your brain says that those aren't safe, then you're left with nothing. So there's just certain things to kind of be aware of. And so occupational therapy has been very helpful with our food. And some kids will do even more stuff, like even more hands-on in their session. Watson, no. Come back to your bed, Watson. And sometimes like she'll throw out suggestions that just aren't going to work for my kids. Like, one thing that I love about occupational therapy is like they just are like an idea cloud. And they keep coming up with suggestions. They tirelessly come up with suggestion after suggestion after suggestion to try to find what's going to work. There's never like, this is the right way, we're going to do this. For instance, a lot of autistic kids that struggle with sense of foods, they will put Vicks Vapor Rub under their nose, and then they don't smell the food, so they can eat the food. To me and to my son, they're like, oh, that's awful. That would just make the food smell like Vicks Vapor Rub plus the food. But for some people, that is a trick that works for them. So there's that. So another thing that we are working on in occupational therapy for my daughter, and it's why she wanted to start back up, is something called code switching. And I've talked about this in a video a long time ago. But basically, masking for an autistic person is dangerous and detrimental to the long-term health of our brain. But once you've been diagnosed with autism and you start to notice, you might see when you're masking. Like for me, before my diagnosis, I had no idea I was masking. Basically, masking is when our amygdala gets triggered and our nervous system goes into the stress responses of fight, fawn, or freeze, and we mask our autistic traits to integrate into a social situation. And before my diagnosis and awareness of what was going on, I would do these things without realizing I was doing them. But code switching is purposely masking your autistic traits to navigate through a social situation for a short term. Neurotypical people do this. A neurotypical person is going to talk differently with their best friends than they do with their boss. It's just, they know that they are going to have to act differently in different situations. So for a autistic person, sometimes, and not all autistic people have this ability, okay? So that's just true. That's why there's higher support needs and lower support needs. But some autistic people can purposely code switch and try to speak neurotypical to get through a social interaction. And my daughter was really struggling to communicate with her teachers, and she has an IEP. They all know she's autistic, but at the end of the day, they are human. And she was doing everything she could to try to communicate. I don't understand this assignment. Please, blah, blah, blah. And my kids are in online school, so they communicate a lot through an email. And the teacher would respond back with like something completely not what my daughter was asking. And she was like getting really frustrated. So she actually brought in some emails and examples to OT, and the occupational therapist kind of broke them down and explained how, each sentence, how a neurotypical person may have interpreted that sentence. I've talked about before in videos how autistic people are bottom-up thinkers instead of neurotypical people who are top-down thinkers. And what that means is that oftentimes an autistic person is going to overload an email. They're going to give all the context. Like at the beginning of this video, I gave as much context as I can, because bottom-up thinkers, we want all of the information and then we go forward. But neurotypical people who are top-down thinkers, they want one little piece of information at a time, and they do more of a go back and forth kind of method, which seems completely inefficient to our brains. But through OT, she was able to kind of like work out a better way to email with her teachers. Let's see. Another thing that my kids are learning to do in occupational therapy as autistic ADHD kids is learn when to give all their effort and when to pull back and just maybe do minimum. That might sound really bizarre, but a lot of autistic and ADHD people are overachievers, overworkers. I have a short on the channel where I talk about this really succinctly, but it's insane. But we give our 150% when a neurotypical person is giving like 80%. I don't remember how I worded it in that video. It was like one of those aha moments, but it is so true. I'm going to link that short down in the description box, just 1 minute short. But it's so ironic because we get labeled as being lazy a lot of the times, when in fact we often give way more. And it's why a lot of times in workplaces, autistic people get snubbed by coworkers because we like, oh, you're doing too much. Like they think that we're trying to suck up when we think we're just trying to survive. We're just trying to get through the day. And we tend to overwork. And I don't know why that is, but it's a thing. And so in occupational therapy, we're breaking down when is the time to give your all and when is the time to just do the assignment at a low level and get your grade. Because if we give our all to everything, we'll burn out. Let's see. Another thing that we do in OT is talk about interoception and proprioception. So interoception is noticing our internal cues, hunger cues, when to go to the bathroom, when you're thirsty, breathing. So breathing is an automatic system, but we can also regulate our own breathing. And oftentimes, sorry if I'm messing up with any of y'all, as soon as an autistic person thinks about their breath, we will mess up our breathing pattern and we will we'll struggle to breathe all of a sudden. A lot of times if we are concentrating, we hold our breath without realizing it. So in OT, we spend a lot of time bringing awareness to our internal senses so that we get practice at maybe checking in with ourselves. So for instance, my son rarely... So for instance, my kids and I oftentimes don't get correct hunger cues, but with practice, we can kind of try to train our brain to check in, like, am I hungry? And oftentimes when we ask ourselves this, it doesn't really help. We don't feel the hunger cues, but at least we're like thinking about it, like, oh, is it the time of day? And the hope is that the more she's got like these different exercises that she's doing with my kids, like she will ask them a certain set of questions about body parts. Like, what does your tummy feel like right now? Can you bring any awareness to your stomach right now? And it's just these kinds of like thinking questions in occupational therapy. And the hope is that maybe we are going to develop a brain connection. That one I'm not so 100%, like I haven't seen it help completely, but we're willing to try it. And I think the logic is there. We'll see. I'm not sold on that one yet. But on the other side, proprioception is awareness of our body in space. And we also work on that one. So for instance, she will say, okay, think about the bottom of your feet. What do they feel right now? And a lot of times people with autism aren't aware of their body in space and how it feels, or, whatever. And where are my feet? Like, it's just, we have a disconnect from our body parts. And so we bring a lot of awareness. She'll do different tactile things with different body parts. For not my kids so much, but for a lot of the other kids, there's a big gym and they'll do jumping and balance beam and like different actual physical things to work on proprioception and just get that like body mind connection a little stronger. One thing though that did help, going back to the interoception, is using vocabulary words to describe pain and muscles. So my son also is we're going through the diagnosis of POTS, and we were seeing a physical therapist, and he had asked my son, how are your muscles feeling? And my son was had no way to communicate. So we spent good 2 occupational therapy sessions going over different ways our muscles can feel after different activities or different states of rest. And they made up a chart, and it was really cool. And so the next time he went into physical therapy, when the doctor asked, he was able to say, my muscles feel like they do after I've done a bike ride or something, just to be able to communicate a little bit more. And that really helped with the physical therapy. It was brilliant. It was brilliant. The OT has also helped me as their parent work out in America, it's called IEP, Independent Educational Plan. And so we talked about what kinds of accommodations we needed to ask for from the school that would be helpful. And so the occupational therapy, while they are not legally, technically, like knowledgeable about everything about IEP, they've been around enough of them that they could offer us really solid advice for our IEP meeting. So that was amazing. Again, coming up with, like I said, all the suggestions, just throwing the suggestions. One place that a lot of autistic people struggle with is hygiene. And so we came up with suggestions to help with the shower, like natural light. So we bought film for the window. Our window's kind of in a back, so you don't really get any of you people seeing in it anyway, but we got one of those films where you can look out, but nobody else can look in, so that some natural light could come into the bathroom a little bit more. Some people like to put like disco lights in the bathroom and turn the lights off. Some people like to listen to music, trying different soaps, different ways to wash your hair, like in the sink versus in the shower versus a tub, like just thinking of different ways that makes it so that your brain is more willing to do the hygiene steps. And again, all child-led. Another huge thing that we've done in occupational therapy is work through being more independent. So my son had the goal that he wanted to order at a restaurant by himself, because again, he has such OCD that stops him and generalized anxiety along with his autism, that when he would be his turn to order, he would actually get select mutism and involuntary mutism, and his vocal cord seized up and he literally couldn't talk. So we talked through that. It was like, okay, well, do you want to be able to order? Because one way that you can accommodate yourself is write your order down on a sheet of paper and hand it to the person. That way you never have to actually talk, but you are still independently ordering. And he's like, no, I really want to be able to talk to the waiter. And so we worked on a lot of scripting. But it wasn't like, again, this is the way it's going to happen. It was, let's think of all the ways that you can communicate and get this in task done, and what sounds good for you, and what goals and what steps do you want to do to get there. And so one of the things that he ended up using for practice was going up to a counter and ordering a Jamba Juice all by himself. And he did great. And it was like after several sessions of scripting and walking through it and practicing in OT. And then another one is replacing any harmful stems. So a lot of autistic people, well, not a lot. My words are stopping right now. I hate to use words like always and never, but as far as I know, all autistic people stim, because pretty much most humans stim to some degree. Autistic people just do it a lot more than a neurotypical person does. And we stim to help regulate our nervous system too. And a stim doesn't always have to be physical. Stimming can also be auditory, a visual stimming, like looking at something like a fish tank or a lava lamp. But some stims that autistic people do actually end up being harmful. So one thing is like scratch, like kind of rubbing on your skin, but if you do it too much, you might actually make it bleed. Another one that I personally do is I've talked about it on the channel before. I crack the cartilage, or I don't even know. It makes a noise and it makes my brain happy and it feels good and it sounds good. It's weird, I know, but I will do that until my nose is bruised and tender and hurting. And so this is one of those things where I was talking about like a fly on the wall. I'm like, I need to change that stimming behavior because it is bad. And so like I've switched to just tapping my nose. It's not quite the same satisfaction as like literally whatever I'm doing to the cartilage in my nose, which probably, again, harmful. It's probably not good for my cartilage in my nose. But like tapping on my nose when I catch myself doing it, at least it gives me a physical motion to do, and it tells my brain like, I know you want to pop your nose, but I'm not going to let you right now. And so I will do that and until the urge passes. And so they worked on my kids on some of their stems that like just, aren't quite really, they're not like super harmful, but like picking at your nails until the nail beds bleed, like that's not good. And so we've learned that motion that they want to do and like translate it to a healthy stem. So obviously a lot of these things that I've talked to you about are occupational therapy for teens that also a lot of times translates to adults. Like I've gotten so much out of listening to their occupational therapy sessions. But occupational therapist also helps with younger children. It meets them at their level, their need, takes their concerns and issues seriously. Like if they are struggling with a social situation, on the playground, the occupational therapist can help walk your child through different scenarios and accommodations and different things to make whatever that your child is struggling with have an outcome, a desired outcome. So in the end, occupational therapy is not ignoring the autism. It is not trying to change an autistic person. It is trying to help teach what types of accommodations an autistic person needs to navigate a systemically ableist society, basically. But even, like I said, it's helping with some things that are just inherent. It's not a society thing, like ARFID, sensory thing. Even if society was like perfectly set up to accommodate an autistic person, struggling with food is still very, very disabling. And having solutions and things that you can try to overcome that is so beneficial. Anyway, that's what I got for you today. If you have any questions, make sure that you ask them in the comment section. I will try to respond to as many as I can. If you've had a really good experience with occupational therapy, please share it with other people because I'm sure that they can do a lot of things that I did not mention in this video. Like, they're very much all-encompassing these days. Like my kids' occupational therapists also almost have become a talk therapist too, which isn't even in their job description. It's just they understand the struggles of the autistic kids more than a lot of therapists that are out there because we don't have enough therapists to understand autism. So a lot of our sessions, like sometimes the first half of it is just them using them as a talk therapist to like, I need to talk to somebody who understands what I'm going through, and they're just listening, and then they can get into the actual work. So my kids to occupational therapists are amazing. I love them. I'm so glad that they have become part of our weekly lives, and I know that we're going to be with them for probably several more years until they age out of the system. And I don't know. I thank you guys for listening, and until the next video, bye.